assessment. Can everybody see?
You can take it, but give it back.
Okay, so you can keep this paper with you. Okay? From fall, when those students are going to come in, they cannot keep this paper with them. So you guys are lucky that you can keep this, right? While testing. So it's a good thing. Yes.
Testing? Okay, keep it.
Thank you. So that's what I said. From fall, you cannot keep it. So you better pass this time so you don't have to come another time. Okay? So you have 20 minutes to do this head to toe assessment. Everything from head to toe, right? Then you might be thinking, how am I going to do it? Most of the time, people can do it. Okay? So, and the good thing, since you would have this form in front of you, you can do it. I would recommend what you do, what you learn, and how you practice. Do head to toe, and then if you forget something, you can look through that and then do that again. No one is going to ding you. Okay? Only thing is, if you forget to identify the patient and you move forward, that's something with safety. Right? You forgot to identify the patient and you did assessment on a wrong person. That's a safety issue, right? So that's we would ding you it. Rest? No. Okay? So, I'm going to go down with the list and then ask questions and then do assessment. If you have any question, only time I'm going to do, there are certain assessment and certain points where a person can be sitting up. Sometimes person can be lying down. I would recommend person would be lying down the whole time because there are things in here, since you're going fast, right? You're going to waste your time in getting person up and putting them down, right? So try to do everything while lying down. Can you do that? Yes, you can. Okay, but I'm going to demonstrate a lot of things while her sitting up, so you can observe that. Okay. If you have any question, pause me at the same time, so we can clarify right there and then. Okay, let's go. So I'm going to first introduce myself. Hello, Haley. My name is Yasmin, and I am your nursing student. Can you state your name and your date of birth?
My name is Haley Howard, and my date of birth is 06/11/96.
No, I didn't say that, right? She's a baby. Okay, I am going to wash my hands, and then I'm going to explain everything what I'm going to do. So Haley, I'm going to do head to toe assessment, going from head, going towards the, towards your toes. During this time, if you feel any pain or you feel any uncomfortable or anything like that, let me know. Do you have to go use restroom before we started?
No, I'm good.
Why didn't I ask her to if she needs to go use restroom?
Because you're going to touch your bladder and stuff.
Touch your bladder, right? You don't want her to pee while you're doing assessment, while pushing on it, right? So you do assessment and you ask the person, because sometimes a person would say, okay, I will only take 5 minutes, 10 minutes. But if you're doing assessment the first time, it takes you a long time, right? Can you do all head to toe assessment on a patient?
Yes.
You can. But if you're doing it for the first time or first few times, it would be 30 to 45 minutes you would be in the patient. And patient gets frustrated. If you would get patient like me, I would slap across your faces too. Because if I'm a mean person, right? Or you're taking so long because you don't know what you're doing, I would do that, right? But if a nice person like Shalana, she would be okay with that. So always ask a person to use restroom if they wanted to. Okay. So I introduce myself. I identify the patient. I verbalize hand washing, and now I'm going to ask orientation. Does anyone know what orientation means? Alert, awaken, oriented times 3. What does time 3 means? Name, date of birth,
Know where they are.
where they are, right, and what day is it. Can I do that while I'm introducing myself and asking her name at the same time? You can do that, so you would not waste time, okay? So let me start that all over again. Is that okay?
Yes.
So you know how to, you can merge things together and do it fast, okay? Hi Haley, my name is Yasmin. I am your nursing student and I would be doing head to toe assessment on you. Can you please state your name and date of birth?
Haley Howard and 06/11/96.
And do you know where you are?
I'm at school.
Okay, do you know what day is it?
May 6th.
Okay, May 6th. And do you know what day is it?
Friday.
Friday. Okay, so she's alert, awake, and oriented times 3. I wash my hands. You do it all that within a minute, less than a minute, right? So you have to be very proactive. You have to be fast. Then I am going to see what's the posture and position in bed. Since person would be lying down when you would be doing assessment, you would say person is in supine position. Right now, I would say Haley is sitting in the sitting position, okay, 90-degree angle. Facial symmetry, I'm going to look at her face. I'm going to see how the facial expression it is. Hers is symmetrical. There is no drooping on any side. Do you see any drooping there?
I don't know. Let me see. Nope.
So there's no drooping on any side. So I'll ask her to smile. So when person smiles, sometimes you see the drooping at that time too. Have you seen stroke people? Bell's palsy, neurological disorder, it happens. So you ask a person to smile to see that. Okay? Then you're going to see the size and shape of the pupil. Do you guys all have pen light? Okay. You guys know how to use it? Sort of. This is not a toy, right? Okay. Everybody has it? And there are sizes on it. You see it? There are sizes on it. So what I'm going to do not go shine light like this, right? You come from side. When you come from side, do you mind turning one light off? Just one light so we can identify it. Right? And move it towards the eye. So, do not, just look at me.
Okay.
Just keep looking at me, do not focus on mine. Okay. If you come closer, you can see her eyes constrict. You really going to see it from there? Come on, move your butt close to me. She doesn't bite, I won't bite. Hi. She gave up on that.
My phone.
Okay, so Haley, just keep looking at me and I'm going to shine a light. See that? You see that? Did you guys see it? Alright. Round, reactive to light, and accommodation. I want you to write it down before you forget. Someone should write it down for
Oh, you have my
Haley.
paper?
I'll write it down.
Just for a second.
Pupils are round. P-E-R. Let me give you P-E-R R-L-A. Perla. P-E-R-R-L-A. So pupils are equal, round, reactive to light, and accommodation. Okay? So when you're documenting any assessment for eye, you people see, when you guys are going to see, how many of you guys still work? Right? When you go look at a patient's chart, you are going to see in the eye it says perla. It means what? Pupils are equal. So does her pupils were equal? They were, right? Round. Was it round? Was it square-shaped triangle? No, right? It was round. You have to put that round. reactive to light. Was it reactive to light? It was, right? And then I'm going to do accommodation. How am I going to do accommodation? I'm going to ask her to just look straight, okay? I'm going to put a light close to your nose. When I'll ask you to look at the pen, at that time you look at the pen. Before that, you're not going to do that, okay? Look at the pen. You see her eyes converges? That's accommodation, okay? Or what you can do, ask her to look at the pen and concentrate on this. You see her eye converges? That's accommodation. Does everyone get it? Question? No. So pupils are equal, round, reactive to light, and accommodation. Got it? Let's move forward. Now I'm going to look at her nose alignment. So I'm going to look at her nose. It's not deviated. What does deviated nose mean? It's crooked or on towards one side. If it's deviated to the right side, you're going to mention it's deviated to the right side. If it's deviated to the left side, you're going to mention that, right? But hers is symmetry, right? It's balanced. Then you're going to look for patency. How are you going to look for patency? Blow. You're going to ask her to put one finger here and blow from the nose. Don't do it too hard because I don't want to clean up the mess here. Okay? And then the other side. Okay? And you breathe. Can you do that on yourself? Don't make a mess, okay? Okay. Then you're going to look for drainage. How are you going to look for drainage? You're going to look inside. You don't have to feel embarrassed because you guys are going to do that on each other, okay? So I look at inside her nose and I found no drainage, okay? Then I'm going to move forward and I'm going to look at oral mucosa, gums, and teeth. What does that mean? I'm just going to observe things inside her mouth. Simple, right? When I'm going to ask her to open your mouth, teeth, I looked at all teeth are present. Mine's one missing. And then ask her to open your mouth. And then look inside, any cavities, look at the gums, bleeding gums, ask her if there's any pain there. And then I'm going to ask her to say, right? So stick your tongue out. Okay, I saw there's a yuwawa there, right? Like I mentioned, you guys might not have it. Or you might have it. You don't have it, right? You do have it.
Yeah, they got it.
They didn't touch yours, they touched yours. So, is that okay if we can look it in your mouth? Okay, let's come here and see. It's different on her. She's the center of attraction now.
Oh, it's still
Stick out
there.
your tongue.
Well, I see it.
Okay, you
It's short
see?
though.
It's very short.
Oh, okay.
It's very short because it's not like sticking out or dangling. Person can do it. You don't want to gag a person by putting a tongue like that. Okay? Then you're going to look for neck vein distension. So how am I going to do it? Ask her to look it on that side. You see, is there any neck vein distension? Just a little bit slight, right? But I do not see any prominent one. Prominent one demonstrate what? If it's coming out like, if you see
Hypertension.
hypertension, good job. It causes, it means it's hypertension if it's like prominent, very prominent. Look on the other side. I do not see it here, right? So you need flashlight for almost everything you're doing. Okay? Then I am going to go for neck range of motion. You guys all have to do it, by the way. Okay, with me when I'll do it. So, ask a person to flex their head. How am I going to flex the head?
Go forward.
Go forward. Okay? Flexion, extension, hyperextension. Okay? So let's do that again. Flexion, extension, hyperextension. And then right lateral and left lateral. Oh, that feels good. Okay, let's do everybody together because you're going to ask your patient to do it. Flexion, extension, hyperextension, right lateral, left lateral. Everybody got it? Okay, let's move forward. Then I'm going to look at her respiratory rate. Does everybody know how to do respiratory rate? Check for respiratory rate, right? Never ever tell your person that I'm going to check your respiration. Why?
Because they'll change the
They can change
pattern.
that, right? Alter it. So you always pretend that you're going to check the pulse and doing respiration. Have you done that before? Right? You do that because you don't want a person to change it or alter it. But for demo purposes, you're going to say, okay, you're going to verbalize. I'm going to check your respiratory rate. Then you're going to do it for 30 seconds.
And we should do that for the test out?
Yes.
Okay.
We have to wait for 30 seconds or just we say it?
No. You have to do it because your instructor, whoever would be testing you, would be doing it at the same time. So if you do it wrong, you do it wrong.
So 30 seconds times 2.
Correct.
And then times your number.
Correct. Then moving forward, you're going to look for characteristics of respiration. While you're doing the respiration, you're going to see how the respiration is there. What does it mean by characteristics of respiration?
Like shallow.
Shallow,
Fast.
Even, uneven.
even, uneven. What's the depth of it, right? So how she's breathing? Can you just breathe? Yeah, right. Of course you're breathing. So hers seems to be fine, right? So she's breathing normal, okay? Then moving forward, thoracic symmetry with respiration. When she was breathing, any side was going up or down. One side is going up, maybe one side is not going down. It happens, right? People with accidents or lumbar fractures or not lumbar fracture, rib fractures. People with alveoli is not working well. It happens with them too, right? Sometimes accidents cause those lungs not to inflate. So what happens at that time? Only one side goes up and one side doesn't. Right? Usually those people should be on ventilator, by the way. So one side goes up and one side doesn't. So what you're going to do, but hers is symmetric, right? Hers is symmetry. Asymmetry means it's not symmetrical, right? Then I'm going to see use of accessory muscles. When she was breathing, what muscles was she using? She was not using accessory muscles. Accessory muscles like using abdomen, using neck muscles whole lot. Like, what does that mean? If I'm breathing deep, what am I doing? Using my abdomen as well as the neck muscles whole lot, right? But like during pregnancy, I am breathing, abdominal breathing. Why? Because I have trouble breathing, right? And it happens, right? Person who is like 300 pounds or something, they might be using abdominal accessory muscles too, okay? So you need to,
Question here.
yes.
I read in a book like if you're a female, you breathe from here, but guys say breathe from abdomen.
Right, but because their thoracic cavity is bigger,
Oh, okay.
that's why. Ours is a little bit shorter, right? Because of our ovaries sometimes makes it different, right? So our thoracic, if you see guys, thoracic cavity is bigger than ours,
Okay.
right? So yes, guys use abdominal muscles, but they use thoracic cavity to breathe. But if you're only using abdominal muscles like here, then there's a problem there. Question? Okay, let's move forward. So while you're doing respiration, at the same time you can do respiratory rate, characteristics, thoracic symmetry, and accessory muscles. You can do all at one time, right? Then you're going to do tactile fremitus. Put your hand here, but I am going to do it on her. Put your hand on your chest cavity or not. Yeah. Put it here and say 99. Say 99. Does it vibrate?
Yeah, a little bit.
It should vibrate, right? So that means it's vibrating, air is going in and out. Okay, so that's tactile firmness. Then I am going to auscultate lung sound. Okay, do you know how to auscultate lung sounds? No? Okay. Is that okay if we can take your top off?
Can I lay down?
Yes, you can. Or you can just put it up here. Yeah. So, if you see, you guys all feel your clavicles, right? Everybody should feel your clavicles. Feel it? Everybody has it? Good. If it's missing, you're in trouble. Okay? So, everybody feels it. Underneath that, there's a space there. Feel it? Underneath the clavicle, it's a space there. Right? That's called intercostal space. This is the first intercostal space. Okay?
Underneath it?
You guys can do it on each other if you feel comfortable with that. You can do it on her if Haley is okay with it too.
Where is it?
Underneath the clavicle. There's a space there. You only feel the muscles there. There's no bone there. Okay?
Right here?
It's right here.
Right, okay.
Yes. There's this tiny space there. That's called intercostal space. That's intercostal space 1. Okay? Then you feel a bone there, and then underneath that there's another space there. So if you do it like this, you can feel it. Right? Here, come here if Haley's okay. Haley. You want to feel it on hers? Okay. There's a space here.
Bone.
The bone.
And then space. Yeah.
Right? So you can feel it on her too. It's easier when you guys would lie down because your muscles and your breast tissue relaxes. It's easier to do it at that time. Okay? So first intercostal space, second intercostal space, third intercostal space, fourth intercostal space, and then you're going to go down. Right? So you're going to say, okay, how am I going to auscultate? Where should I do it? What would be the location? Your location should be where your sternum is. Do not do it on sternum or do not do it on the ribs. Okay? Because on ribs you might not be able to hear it now. But you have to hear the breathing in and breathing out on the intercostal spaces. Okay? So, in order to make it easier, always go with the second intercostal space, fourth, sixth, eighth, and then 10. Okay? Now you're going to say, how am I going to do it? So you're going to put a... She said, I don't know, it's not like...
Oh, it's
Oh,
fine.
it's okay. Okay, so you're going to, first intercostal space, then I'm going to put it on second intercostal space. So I'm going to put a stethoscope here. Then, before going down, I'm going to go across on the side. Why?
To see if they're the same.
To compare it. Excellent. So I'm going to do it here, then the second intercostal space. Then going down, I'm going to miss the third intercostal space, do it on the fourth intercostal space. So I'm going to put it on the fourth intercostal space. Do not do it on sternum, do not do it on the ribs. Okay? Then going across, you're going to do that. Same thing. Then you're going to miss the fifth one and then you're going to come down to sixth one. So what's that?
Why are we skipping?
We do not do it on each and every one, right? The reason we do it because you want to get results faster, right? Have you seen doctors doing on each and every intercostal space or nurses doing on each and every? No, you're just getting a baseline how it is, right? Then you're going to go on the sixth intercostal space, that's her rib. So six intercostal space is somewhere right here. right? It makes it very easier to do it on the patients because they do not have bra on. And a lot of time what happened, their breast tissue goes on side.
Oh yeah.
So it makes it more exposed. Right? Trust me, I know.
No problem with
it. Yep. People who are smaller than one, I cannot do anything about
Do
it.
we listen to the apex of the lung above or just skip that?
You're not going to, no, you're not going to do that, no. You're not going to do that. Then you're going to do 6 intercostal space, right? And then you're going to come down to, you're going to miss the 7, and then you're going to come down to 8 intercostal space. So I'm going to listen here. So you're going to go like this, 1, 2, 3, 4, 5, 6. Does that make sense?
Skip
So
7.
you're going to
go
do
8.
1, 1, 2, 2, 3, 3, 4, 4, 5, 5. Okay? That's what you're going to do. Like for example, second intercostal, 4th, 6th, 8th, and then 10th goes on sides.
Okay.
Okay? Because you're going to say, she told us about 10, but I can only find 8 intercostal space and it ends here. 10 goes on sides. Okay? Because if you see after 7, 8 is the last intercostal space. You can feel it to your own ribs. Right? And then you go on sides to check it. What you're going to do, ask a patient to take a deep breath. And you take a deep breath, you hear an inhalation and exhalation. Okay? Breathing in, breathing out. How well you breathe. Okay? When you guys would practice, after this you're going to practice. Maybe Monday would be a good time. We have a mannequin that has different lung sounds
Oh, that would be nice.
that you can hear. What does crackle sounds like? Right? Patients with pneumonia, they usually have crackles, right? Or the bubbly, watery sound, right? It means it has water in it, right? Then what you're going to do, or sometimes you have friction ribs. What does that mean? Ribs are touching each other. It means one rib is broken and it's touching the other. It's very painful. So when you breathe in, you might be hearing it doing rubbing. Breathing out, you would be hearing it breathing, right? And then also wheezing. You can find wheezing up on the upper side, right? Because what happens in wheezing? Anyone has asthma?
Maybe like obstruction here in the bronchioles.
What happens at that time? You have trouble breathing in or breathing out? In, right? So what is happening? When she's trying to breathe in, the air is constricting. It's not letting it go. So where does the air starts coming from? It goes from here, but it stops here in the bronchi, right? So it constricts. When it constricts, you hear the wheezing. It's trying to go and force it inside. That's what it happened. Okay? Then I'm going to, same thing, you're going to hear different lung sounds. So when we have time, we'll demonstrate that to you. Okay? Then you're going to go on the 10th. Okay? Did I do auscultation? I did. Moving forward.
How about backwards, no?
The back. So, but if sometime when person is sitting, lying down, you do, while you're doing assessment, do all at one time from the front. Whatever is left, the only thing left is doing the lung assessment on the back. You're going to do it at the end. Because if I'm your patient and you're doing whole head to toe and you're putting me up and putting me down, and I would be pissed, right? Just think about putting yourself in that situation. So you're going to do, yes, you're going to do back as well. So when we do front, we'll go on the back and I'll demonstrate that to you, okay? Then moving forward, sacral area pressure, that also goes on the back, and we'll do that later. Then auscultate aortic, pulmonic, tricuspid, and mitral valve. Have you done the cardiovascular yet in the class?
Yes.
Okay. Who can tell me where can I find aortic valve?
The right would be the second intercostal.
Second intercostal on the right side of the sternum.
Okay.
Okay, so you guys now know where to find second intercostal space. You're going to find the aortic valve. Okay, so when you hear it, you can hear the valve sounds here. Okay,
And that's the valve opening and closing?
correct, correct. So that's the first intercostal space. Second intercostal space, you're going to find aortic, right? Across from it, what you're going to find? Pulmonic, right? On the second intercostal space, you're going to find pulmonic where on the left side of the sternum. Okay? Then going down on the third intercostal space, you're going to find Erb's point. Have you read about that, Erb's point? Okay. Erb's point is where S1 and S2 both are equal. Do you guys know what S1 and S2 is?
Love and dub.
Lub and dub. Who can tell me which one is louder on the aortic?
That's one.
S2.
You have a book. Look into that. What does it say? I'm not going to tell
Isn't
you.
it S2? Yeah, S2.
Okay, S2 is greater than S1 in the aortic. So you're going to verbalize, you're going to hear it, and you're going to say S2 is greater than the S1. Then pulmonic, S2 is greater than S1. Then the Erb's point on the third intercostal space on the left side of the sternum. Both are equal sound. S1 is equal to S2. Okay? Then on the left side, because your heart is on the left side, I guess, right? On the fourth intercostal space, on the left side of the sternum, you're going to find you're going to find tricuspid. So, aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. Now you're going to say, how am I going to find all these things? Let's do it, okay? And remember, S2 is greater on the aortic and pulmonic. Erb's point, S1, S2 is equal. And on the mitral and tricuspid valve, S1 is greater than S2. Okay? So let's see how we can do this. So, this is the second intercostal space, third intercostal space on the right side of the